Let us know what's up on our KOM News WhatsApp tip line at 671-727-0094. Share information about what's happening in your town, on Guam or the Sinamai, and what you want us to know. Reach us on WhatsApp at 671-727-0094.
All right, we are back, and welcome back to the show, everybody. We are back on the hotspot. We are coming to you live. And our good friend, Dr. Margaret Hattori-Uchima. Now, let's see. I mean, we could go through her entire resume and everything like that. Like, we'd be here until 4 in the afternoon. Yeah. But of course, she is the dean of the School of Health. It is, of course, Charter Day. So, Biba UOG.
Biba UOG.
I had the very great pleasure of being able to interview about that. So, if you guys want to watch my extended interview with Margaret, go check it out. It's on YouTube right now. But some of the highlights were, no one can be prouder of the performance that your students did, that your staff did, that the administration did in keeping these young nursing students that will go directly, what some people still believe is like the line of fire and everything like that, but you all performed beautifully.
Well, and I know you say we, right, but I have to say the hospital nurses
Of course.
really are the ones that perform beautifully, because they had to take our students, and they were willing to take our students. I mean, at first in March, right, we stopped our clinical at GMH because they were overwhelmed. But then very shortly after that, in the summer, GRMC let us take our students to GRMC, and then we were able to resume at GMH. But the graduates in April and May, in April, right, we graduated them early, they were all mentored by GMH nurses and GRMC. And so, I mean, I just put myself in their shoes. In the middle of a pandemic, you've got these brand new nursing students, right, that graduated early, but super dedicated. I mean, we told them, hey, if you want to sit out because it's a pandemic, and at the time, no vaccinations, we really were worried about their life. We said, you can sit out. I won't hold it against you. You can sit out. If you have family needs or whatever, we're not going to force you to continue. 100% of the students agreed to continue and graduate early.
Because they were like, this is why I made the choice to do this.
I know, I was in shock. All the faculty, we were in shock. I had everyone email me their decision, and I gave them till a Monday. By Sunday, they had all responded, and I was like, every email I read from the student, I was just like, almost in tears, like, oh my God, I can't believe they're all stepping up. But then to, the GMH nurses and GRMC nurses to take newbies, and public health also took some new students, but to take these new graduates and really mentor them. I've got one that still works. You guys have interviewed her. She still works in the ER at GMH. And just shout out to all of them, because I know they're tired. They had to study for NCLEX. They've all passed NCLEX.
I do want to mention that, though, Bree, real quick, because the two stats that absolutely blew me away are, when I interviewed Margaret, are the fact that UOG has a 100% rate for all the School of Health graduates, right, of finding employment within the first 6 to 9 months.
Yeah.
And for the nurses, it's 96.5% of them pass their NCLEX exam, which is not, like an easy, just write your name at the top. That's a very demanding, rigorous exam. Well, they all 96.5% pass it on the first try.
I know, Mike. He's so good. Well, and we had 4 years prior to 2020 of 100%, which is crazy. I mean, I don't plan on 100%, but to have 4 years of 100%, and then the pandemic, I kept saying, I'm not going to worry about the pass rate. We just have to graduate and help them as we can to pass NCLEX so that they're licensed. But then to have that 96%, it's still way above the national average. So, but that really, thank you. But that really speaks volumes to the whole island helping our graduates, because those nurses working in a pandemic have to tutor them, right? Ask them about their medications. They don't just say, here, go take care of your patients. They know that they're going to take NCLEX, so they'll quiz them. They'll give them advice, and we've all been there. We've all struggled through NCLEX, so we know we have to help each other. So I just like to think of it as a, really a feather in the cap of the whole island, because it takes the island to help graduate these people, but then to help them pass, because you need that support, right? It's a huge support system.
I wanted to ask you about, as we start to come out of turn the corner of COVID, what has enrollment been like? You talk about the pandemic and, this commitment, but have you seen more and more people wanting to get into the nursing field?
Well, we've always had a huge demand that we couldn't meet, right? We don't have the capacity. Our building is small, but we've got plans for expansion. But I'm surprised, yes, our nursing assistant program has taken off. We always have to turn people away. In fact, I believe we have a wait list for that.
Wow.
Yes, and we just finished another cohort. Their last day of clinicals yesterday at GMH, and they're so excited. We recently had one at GRMC and GMH.
Yeah, you guys are up next for a new building. Everybody else got a new building.
Yes.
Come on, guys, School of Health.
Yes, we're getting a 2-story annex.
Very nice.
Yes, yes. We're very happy about that. And so that will help us expand. But yes, there's a huge demand still, and we're very happy that students want to continue, to help and go into healthcare.
Well, I wanted to switch gears to the work that you do with the Guam Homeless Coalition, and there was a meeting today of OHAP. If you can tell us, you were mentioning during the break that there actually is going to be an outreach coming up.
Right, right. And so we have it's the Governor's Interagency Council meeting, and OHAP is a part of that. And of course, it's always a great meeting. The Lieutenant Governor's the chair, and I have to say, it's a great council. I mean, I'm not bragging about me. I mean, the other members, right? I mean,
okay.
You've got people from GURA, and God bless, Ray. He was just such a driving force and a great member of OHAP. But we've got a homeless passport to services coming up in April that the Homeless Coalition is organizing. Catholic Social Services in charge. So that's April 22nd. It's a Friday, and it's our annual event. We only missed 1 year because of COVID. But we will have the service providers from both GovGuam agencies and nonprofits that will be there to provide services, both health services and social services.
Has the official report on the pit count, has it been released yet? Because
sorry.
I know that we've been hearing about it, and I think I've
Right.
even heard you talking about it in one of the OHAP meetings, because HUD kind of changed some definitions
Right.
for homeless people. And you were talking about when these volunteers were going out into the community, they were so shocked at the living conditions of some of our neighbors. So when are we going to see the official report come out? I know this was kind of the basis of Operation Homebound.
Right, right. Well, unfortunately, we had the debrief, which was helpful because the data is taking a little longer than we thought, and partly, I have to say, which I didn't expect, but I heard it at the debrief from Salvation Army, who's in charge of the data, that a lot of the data, they have to clean the forms. They have to go through the forms. There's some missing data. And just as someone who was out there also, it was very stressful because we had to worry about COVID. And, we have a lot of non-nurses that were doing the surveys as well. So we had to train them the right way to put on your gloves, the right way to take it off your gloves. We had to use face shields and N95, which, the nurses were used to the N95, but the non-nurses aren't used to wearing the N95, and it's hot.
Neither are journalists. Journalists have to get used to it too.
Right,
That was not easy.
And so it was hot, and so I could see that there were, forms that people were missing some data. So that's why it is taking longer to go through the data. But fortunately, from the debrief, we were able to share information with the speaker, with Lieutenant Governor, with all of, with OHAP, and as well as the other members on the Interagency Council. And that's, partly the reason that Operation Homebound, one of the reasons that Operation Homebound was established and set out, and that's going well. We talked about that a little bit today. But, I think it's increasing the awareness of the increased poverty. I mean, people say, oh, Margaret, it's always been that way. People have always been living under canopies. And as someone that's always been counting, I mean, I don't know how many years now, I don't know, it just felt like there were more people. And I think, and I'm not trying to be naive, but I think what struck us was there were more families. And I met more people that had jobs like the end of last year and lost jobs, lost cars, kids that moved and didn't have a car, the family didn't have a car to go get them registered for the new school. And so all of that, those things are being addressed. But even today we heard, Public Health has a backlog on the applications for benefits, right, in the benefits section. So they're working on that. So that tells you there's a huge demand. So I don't believe people when they say, oh, it's always been this way. I mean, everyone in the Homeless Coalition says, yes, it's been that way, but we feel that it's increased. The numbers are increasing. And I think, I mean, all of us, can look around and see that there are more middle-class people suffering, that more people are being affected by, by the rise in gas prices. I mean, we can't ignore that. And so to say it's always been that way, I think is a cop-out. And so what? Even if it's always been that way, is that acceptable? Is that acceptable for us to see a child, an elderly, a grandparent? There's one child, mother, dad, grandchild, grandparent living under a canopy. You know, and that really was very upsetting. And that's not the only family, right? There were many, many family situations like that. Kids not in school, right? That need to be. So yes, I think I know we need the data.
Yeah.
And we need to report that to HUD. So, you know, the Salvation Army is really working on scrubbing that data. However, there was also a referral form, separate, right, from the survey form. So the referral form data has already all been entered, and the referrals have been sent out.
Well, given the emotional gravity of that, I have one final question before we let you go. Is the Energizer Bunny has nothing on you, Margaret. As long as we've been able to call you a friend and be able to like rely on you for information and feedback. You do so many things with nursing, with social work, with health science, with the homelessness. These not only take a physical and mental toll, but the emotional part of it and everything like that. What keeps you going, and what allows you to be motivated, to be the dean of a college with that much responsibility? And then also, when the vaccine clinic started at the field house, you were walking over during your breaks and actually administering the shots yourselves.
I think your daughter too.
Yeah.
Yes. What keeps Dr. Margaret Hattori-Uchima going?
Well, for me, it's really the individuals. I get tired, and then I see a student who was living in poverty, now RN, working, supporting her whole family, and a role model for her community. And going out there and doing outreach herself, like, oh my gosh. And she actually talked about that with our students and with our administrators. So, you think about that. And then one day there was a pregnant woman, it was on account, and I was so tired. We were out, and the Homeless Coalition even called and said, Margaret, come in. We need you to come back into the office. So I finally went back, but the last person we saw was a pregnant woman that needed prenatal care.
Yeah.
Months later, her husband calls into talk radio and says, and I just happen to be listening, and says, I just got to say thank you to Margaret, because my wife delivered a healthy baby. So, it's these things that you don't think of, you don't hear it every day, that when I'm down and depressed, I look at that and say, oh my God, it just took a little extra. I was exhausted. I could have gone back to the office. I could have gone to take a nap, right? But just that extra 5 minutes, finding this mom in a van. And it was my coworker that found the mom in the van.
You were able to reach another Guamanian and make a difference in their life.
Right, exactly. And so to me, we have to think about that. I can't solve all the homelessness in the world or on the island, but if I can help one person, that's good enough for me, right? And you can help someone. And if all our students help someone, right? All our graduates help someone. I mean, what a great world, right? And you can see it. So it's a great team that I'm surrounded by. It's not just me.
Absolutely.
I mean, look at the Homeless Coalition. Those people are really heroes, right? They're great.
I'm sure I speak for Sabrina and all of us here at KWM when we say the one day when they decide to rename the School of Health as the Santa Margaret School of Health and everything, you've got our full endorsement.
You're
happily.
so funny. No. So a lot of people ahead of me that deserve that building to be named.
Yeah,
Well, we thank you so much.
And they've got a
Thank
great
you.
leader at the head, so certainly.
Thanks so much.
Thank you
Thank
for what
you.
you do for the community.
Thanks.
Stay tuned. The hotspot continues after.